Sir, can we start? Yeah, we are going live.
Yes, yes.
This meeting has live stream, sir.
Yeah.
Yeah, it's going as live stream. Very
Started,
good
I
evening,
think, sir.
everybody. Yes, sir. Yes, Raj, you can start.
Sir, very good evening, all the eminent actors. Thank you so much for joining us today's webinar. Spread awareness about rabies, which is fatal, but it can be avoided once appropriately vaccinated. This is an initiative from Kedila through its innovative to serve society and humankind. The today topic of the webinar is novel 3-dose G protein vaccine, ultimate key for the complaints. Dear Dr. Rabies is the world's first 3-dose anti-rabies vaccine. And with a great pride, we would like to inform you that Rabies has successfully completed 1 year of the launch. With more, Dr. 40,000 animal bite victim has been vaccinated, 100% compliance was recorded. And there is no case of adverse drug reactions was registered, Dr. And with this, it's my honor to introduce you the speaker today's webinar, Dr. Chaudappa, general practitioner and diabetologist. And also, sir having own clinic in KK Nagar. The hospital name is Rekha Hospital. And almost 41 years are having the experience. And sir has conducted many trials with various pharmaceutical companies like screening in India and major depressions in clinical study, ciprofloxacin, then diabetic and hypertensive. And also sir has having had many companies to speak most of the topics like cardiovascular, immunogenicity and antioxidants like. So Doctor, now I would like to initiate Dr. Chaudappa to talk later on. We will have the question session. All the participants can drop on their question in the drop box. We will be read out all the questions after the presentation. And now over to you, sir.
Yeah. Thank you very much for the nice introduction. I think it's a novel 3-dose G protein vaccine for the rabies. And I can say it's a novel talk, we can say, because it is a widespread occurrence of rabies, but rarely talked about. All the meetings, symposiums, seminars, conferences are based on diabetes or hypertension or cardiology. And so far, I think very few speeches have been done on rabies. And it's very important, and every second there are so many deaths in our country due to rabies. So it is a very important topic for all the practicing physicians. And I think we are going to get a lot of exposition to this particular topic, and with a novel 3 doses vaccine. That's what we are going to see today. I think it's not changing. So I think it's not changing.
Sir, it is, sir. Slides not changing, sir. Can you verify?
Yeah, it's not changing.
Slides not changing, sir. It's not changing.
You are able to change the slides?
Sir, actually, I cannot able to change the slides, sir, because I have not shared.
Yeah. Yeah, I think sorry for the delay. We can go for this. Rabies is a public health
Yes.
challenge in India. Globally, 59,000 human deaths annually. So it's the very highest one. And India has got 20,000 human deaths a year from rabies, accounting for 60% of the rabies deaths in Asia and globally. 91 deaths in India occurred in rural areas, 90%, 91%, because they are having less chances of getting immunization. Number one. Number two, I think they don't not inclined to take injections and they think it is normal. So that kind of attitude they have. So the current management we are going to see. Here, local wound treatment, first aids. So what to do with the, in the beginning, what we have to do as a first aid treatment. Then we can have to go for the active immunization where vaccines are provided. The other one is passive immunization. So usually active immunization, everybody knows. Passive immunization, we go for serious bites where the bites are there in the head and neck. Those places, face and head and neck, we go for a passive immunization where we give rabies immunoglobulins. So earlier we have a 5-dose intramuscular regime, 5 doses and 5 visits. So here, so 0 first dose, second dose is 3rd day, 7th third dose, 14th day 4th dose, 28th day 5th dose. These are the regimen following for the past many decades. Now, going for the non-compliance. Here, current rabies vaccine are cell-cultured vaccines. Inactivated vaccines are 50 years more than the 50 years old technology. Inactivated vaccines. So inconsistency in potency, and there we have to see the stability. Availability. So availability is a short supply. Then adverse events, because they contain protein molecules, they used to give allergic reactions in the humans. Here, non-compliance, who received full courses of, we say compliant for the people who have received full course of anti-rabies vaccine. Excuse me. Yeah, and that is the scheduled doses of ARV on the recommended dates. So when they take all these courses, then we say they are compliant. Delayed compliant is who completed the scheduled dose of ARV within 60 days, but deviated from the scheduled regimen. So usually we complete in 28 days. If it is extended to 60 days, we say delayed compliant. Then we go for a dropout or non-compliant who had taken at least 1 dose of ARV after animal bite, but not completed all the scheduled doses. So these people non-compliant or dropout. Here, rabies post-exposure prophylaxis. Here, practice in view of the new centers of disease, control and prevention of, and World Health Organization, WHO recommendations. Retrospective analysis done at travel clinic. Total of 110 patients who received rabies 4-dose post-exposure prophylaxis. Shortcomings in the management of these patients were late initiation of rabies, PEP in travelers, administration of human rabies immunoglobulin, antibody levels less than 0.5 international units per ml in 6 of 90 patients, 6.7% after 4 doses of vaccine. So 4 doses gives good immunotherapy. So here conclusions are, patients do not always receive optimal doses of rabies PEP under real life conditions. A significant proportion of patients did not develop adequate antibody levels after 4 doses of vaccine. So non-compliance is due to, so non-compliance to 5-dose proven cause of death. Here, so the post-exposure prophylaxis, the 3 doses are given. There, I think street dog, the dog was killed soon. Purified check cell vaccine was given. 3037. No rabies immunoglobulin was given. Dog bite is category 3 at the right side of the nose. So face is very dangerous because it is very close to the brain. 20 days paresthesia of face, 20 days fever and restlessness, 5 days altered sensorium, 1 day. So CSF findings they have done. Total cells are 5, and then monomorphs 100%, protein 126, sugar 71, negative staining. There is no virus isolated. Diagnosis considered is rabies encephalitis. Confirmatory test, rising serum and CSF virus neutralizing antibody titer. That is, rising titer is an indication. MRI findings, bilateral brainstem, mild hyperdensities without any restricted diffusion or contrast enhancement on day 2. So modified Milwaukee protocol from day 1. Hospital survival of 16 days, but died after 1 day due to left against medical advice. So in the other 38 male, a street dog, status unknown, dog status is not known. 3 doses were given, 037. Here, dog bite category is 7, left mid cough. There is a severe bite in the mid cough, 15 days. Dysphagia and restlessness, 3 days. The CSF findings were not there because they left without medical advice. The case is termed as rabies encephalitis, and confirmatory test was not done because the patient was available. Lama on the same day of admission, they left, and the death followed after 2 days. Expired on day 2 of admission. So here also the death has occurred. And another case, 34 male, street dog, status unknown. 3 doses, vaccine type unknown. No rabies immunoglobulin was given. 3 doses were given. Dog bite category 3 at right dorsum foot, 17 days. Dysphagia and restlessness, 3 days. So here, total cells, CSF was done. Total cells was 60, monomorphs 100%, proteins 84, sugar 58. Here also negative staining. The diagnosis is rabies encephalitis. Here confirmatory tests were done. Rabies RNA PCR positive from CSF and serum, but virus neutralizing antibody titer. Here also MRF was not done. Patient died after 2 days of admission. The reason of deaths may be due to lack of administration of rabies immunoglobulin or poor compliance due of the vaccination. Here, compliance to post-exposure prophylaxis among animal bite patients, a hospital-based epidemiological study. Here, they have done animal 360 cases were done, and pre-designed, pre-tested, structured questionnaire was given, was administered by the interview technique. 53% were non-compliant to the full course of ARV. That's a phenomenal thing, you know. So only 47 they received complaint and they received the full course. For 53 they left the treatment. Here, compliance to anti-rabies vaccination in post-exposure prophylaxis. Here, compliance to antibody vaccination has been done. Day 0, 100%. Day 3, only 88% taken the vaccination. Day 7, 85. Day 14, 70. And day 28, only 60% they have taken. So 215 animal bite patients were selected. Gradually the compliance reduces when you go for 5 doses. The compliance rate for intramuscular rabies vaccination was about 60% only. They have taken the complete course. Now here, constraints for the compliance of the rabies vaccination. Here, interferes with the school timing because the children have to go to the school. At the same time, they may ask the child to come at 9 o'clock to the hospital. So they go to the school and they leave the vaccination. So that kind of people are 11%. and distance of the hospital. If the hospital is too far away, they are reluctant to go. So another 11% gone. Cost incurred, I think they have to buy this injection and then get vaccinated. So there, I think because of the cost, that they don't have money, the poorer sections of the society, they leave it. So they formulate around 13%. And forgotten dates. Some people forget about the dates of vaccinations. That also comes to the 18%. So loss of wages. Supposing if the person wants to go to the hospital, they have to take a leave on a particular day. So they will be losing their wages on a particular day. So that constitutes the maximum, 47%. The major constraint for complaints to complete ARV was loss of wages. So the people who are working, they skip the vaccination and go to the work because they can earn money there. Here, evolution of rabies vaccine. Here, nervous tissue and cell culture, two varieties. Live nervous tissue, live attenuated vaccine, spinal cord. Inactivated vaccine, brain up to 10%. So here, in 1885, this is such a olden days, this is not a standardized dried preparation. Up to 31 injections are increasing immunogenicity. So it's a large number of injections they have to take. In 1911, inactivated vaccine was prepared. Here, minimal neural content, liquid preparation. They came to 14 injections, each 0.5 ml daily for 14 days. So this was very popular for a few decades. And in cell culture, here, inactivated vaccine is used in from 1976 onwards. Here it is standardized, immunogenicity, lyophilized. Only 5 injections, 0, 3, 7, 14, 28. These are the 5 doses given, and still we are following the same regimen. Non-compliance led to evolution in treatment regime from 31 doses to 5 doses and still on. So the 31 doses, I think a lot of people left the complete treatment. Now 5 doses, to some extent, they are able to complete the course. So meeting the unmet medical need. Introducing a novel vaccine with simple and shorter regimen. Here, you can go novel 3-dose recombinant Rabies G protein vaccine. Here, first vaccine with 3-dose intramuscular regimen only 0 day, 3rd day, and 7th day. Only 3 doses. Prepared by VLP platform technology, and first protein subunit vaccine was given, and then prepared by VLP platform technology, then goes for the 3 doses. This lands up in better compliance due to easy to flow regimen and less visits. So this convenience is ready to use. No reconstitution is needed. So the doses are given as a reconstituted, ready to use preparations. So where there is no person is involved in reconstitution. Here, VLP technology. Yeah. VLP means virus-like particles. Now, native virus is there. From there, G protein is difficult to stabilize. G protein isolation using VLP technology, purified and stabilized by Cadila Pharmaceuticals Limited. Here, virus-like particles, VLPs, or protein complexes exist as nanoparticles. VLPs are similar to native virus particles, but do not contain the viral genome. If the viral genome is there, it will replicate and produce the infection. So that is not there in this. They cannot replicate, but can mimic the viral antigenicity without being pathogenic. That's what I said. So there is no pathogenesis. It won't produce the disease, but at the same time, it will stimulate the antigen production. They are capable of inducing a strong humoral and cellular immune response. So the both varieties of responses are given. So VLPs as vaccines, virus-like particles are used. Here, clinical phase 2. Here, study design and 0, 3, 2 doses and 3 doses were both used. Seroprotection data has been collected. Here, safety and immunogenicity, clinical study of phase 3. Here, safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization. Here, a randomized comparator controlled multi-center phase 3 clinical study. This has been done. This is done to evaluate immunogenicity and safety of rabies G protein vaccine administered as a stimulated post-exposure immunization in healthy volunteers. Here, randomized comparative controlled multicentric study was done. Total patients were 800. The efficacy and here the seroprotection has been seen. The results were consistent across different age groups and genders. Observed difference is 1.52, that is 95%. Here with pre-specified margin is of 4%. Non-inferiority for seroprotection. Primary endpoint day 14 and day 42 were met. Test and comparator are identical in seroprotection rate, both on days 14 and 42. So, and the safety also is there. This vaccine has got no local adverse events. Systemic adverse events also were very minimal, and this has been selected for that. Here, novel 3-dose was non-inferior to reference vaccine, less adverse effects compared to reference vaccine. And novel 3-dose was found to be safe and immunogenic and was comparable to 3 doses of WHO pre-qualified vaccine. Here, and results were spoken, efficacy and then safety. Study conclusion is we have done. And awards, I think, Pharma Innovation of the Year by Economic Times, Golden Globe Tigers Award, Malaysia Innovation Product of the Year. They have got these international awards. Thank you for the listening. And I think this is a very good, important topic. And we have seen positive cases also in our clinical practice. And it is very pathetic. They come with the dysphagia, not able to drink even water. And the patients, when they are admitted even in ICU, the people are not saved because rabies is 100% fatal. So it is very important to take PEP, that is post-exposure prophylaxis is a must. And we at present, we have a regimen of 5 doses, and here compliance is less, and people tend to discontinue in between when you say all these things. And we just talked about the compliance is due, non-compliance is due to timings, and then the cost of the injection, and loss of office days for the wages and other things for people who are employed. And children going to school, they also miss the dose. So non-compliance is the biggest part. That's why the olden days, 31 injections became 14 injections, 14 injections became 5 injections, and 5 injections we have been giving it for the past very many decades. And a novel idea this company has done, Kerala Pharmaceutical has done, and they brought 3 doses, and they have done studies to show how efficacy of 3 doses compared to the 5 doses of previous regimens. I think 3 doses, the patient will definitely agree and follow. Compliance will be very good. And as shared by the scientific evidence, the immunogenicity is on par with 5 doses. So I recommend 3 doses is far better because of compliance, completion of vaccination. PEP program. So thank you very much for nice listening. And we help the people who got bitten by the dogs. And these rabies are more common. Dog bites are very common in summer holidays because the children are free and they'll be roaming about in the streets, playing in the streets, and very close to the dogs, exposed to them. They land up in more cases of dog bites during summer holidays. And we should be watching well. And these people are, I request these people to have a good stock of these vaccines so that we can utilize them and prevent rabies in the people who are bitten by dogs. Thank you very much.
Thank you so much. Thank you, sir. Thank you so much to Dr. Chaudappa, sir. It was indeed a very, very vivid and a very lucid presentation in this afternoon. Thank you so much, sir. Sir, actually, there are a lot of questions which have come from the participants. I would like just to ask a few of them. One is like sir, just now you highlighted about a few signs and symptoms of rabies. Can you please elaborate on that, sir? Like some of them have asked about the signs and symptoms of rabies. How to identify?
So a person coming to the general practice clinic, they just land up with all the relatives. Most commonly, I think younger individuals, like teenage people, they come, and even otherwise, even younger children also do come, and along with the parents, they come, and the parents say nothing else. They would have forgotten about the dog bite earlier, and they say the person is not eating properly and not even a liquid diets for the past 3 or 4 days. That is the complaint. When you see the person is naturally dehydrated, and when you attempt to give water, they are scared, they run away because of severe dysphagia. This is the commonest symptom we have seen in rabies, and that is due to involvement of the brain. The vaccine, virus enters into the central nervous system and damages the neurons. There, the people land up in dysphagia. That's the most commonest symptom. And because of that, they start screaming and crying, shouting. And they become dry in the mouth. And then the shouting also becomes hoarse. That's why they'll say he's barking like a dog. That's what they say. And the most commonest symptom is dysphagia. Other symptoms involve other musculoskeletal system also, where paralyzed muscles also we can see. But the most commonest symptom is dysphagia and irritability. They are very much irritant because of the inability to take any food. I think I answered the question. Hello.
Yes, sir. Yes, sir. Thanks for addressing the question, Doctor.
Yeah.
And one more question from Dr. Vinod, sir. I can read out the question, sir.
Yeah.
What are the advantages of 3-dose anti-rabies vaccine?
Yeah, it's a wonderful idea because most of the cases where we see they drop out due to more number of vaccines, more number of dates to attend the hospital. See, mostly nobody is interested to attend hospital even for a serious problem, unless it's too serious. So number of visits are more, and the number of visits when they're less, the people are complained. Supposing instead of 5, if you say 3 on 0 day, 3rd day and 7th day, very, very, very simple. And one more thing, it is only just within 7 days you are going to finish the immunization. And because all the people will be complained because they have the fear that dog bite is going to do something wrong and they'll land up in death. So that fear will be there because the duration is short, 7 days. If it is for 30 days or 1 month, the people tend to forget. The fear comes down. So they will be non-compliant. So they won't take the rest of the injections. They may take 2 or 3 and then forget about it. If there are only 3 doses, when we explain only 3 doses, the patient is happy and cost also comes down. Compliance increases. Patient will take all the 3 injections because they have fear at least for 10 days or 15 days. So we'll be finishing within 7 days before their fear goes out of their mind. So when they're fearful, they definitely attend a clinic and take the injections. That is the most important one is compliance. Number two is cost of the treatment. So cost also comes down when the number of doses come down. So transport, other things, taking leave from the office, so loss of wages, all those things are limited to 3 days only. So there also, so the it's indirectly economical. So people may not lose the other day's wages. So indirectly it is economical, and compliance is there, and number of sittings are very less, and efficacy has been scientifically proven comparing to the 5-day regimen. So this vaccine is wonderful, and compliance is so good that we complete the course, and doctor is happy, and patient is also happy because of the completion of the course, and they never go in for death. Yes.
Thank you, sir. Thanks for addressing the question, doctor.
Yeah.
And one more question, doctor.
Yeah.
Sir, what type of animal bite cases you come across apart from the dog bite?
Yes. See, dogs are notorious to harbor the rabies vaccine in their body, and it is dormant in the central nervous system of the dogs in the brain. So, like this, I think we have other foxes, animals, other animals like foxes, and bandicoots. Bandicoots also were very notorious. Sometimes some infected cats. So cats, bandicoots, foxes, and dogs. These are all the animals which are notorious in harboring the virus in their body and capable of transmitting the rabies. So other animals, we have to see this also. Cats, bandicoots, foxes.
Thank you so much, sir. I think we are addressed almost all the questions, sir.
Yeah. Thank
Can
you.
you please, yes, sir. Can you please share your own experience about the rabies attack?
Yeah. I've started this vaccination a few months back, and all the three, the patient is to complete all the 3 doses, and they are very happy because the number of doses have come down. The moment you say it's not 14, it's not 5 injections, it's only just 3 injections, they are very happy. One is less pain, and less a number of occasions for injections, and less cost, and less investment, and less absenteeism from the school or working place. So I've seen that way. Those patients, they have completed the course with happiness. So 3 doses is far better than 5 doses.
Thank you so much, sir. We thanks for the informative talk. We truly appreciate your effort, doctor.
Thank you, ma'am.
Thank you, sir.
Right.
Technical team, now the session has ended. Can you close? Hello? Can you hear me, technical team?